In the few minutes I have today, I feel it would be most useful not just to share our excitement about the present and future of metabolic therapies, but to explore a little of the past to understand why it is that nearly 1 century after the ketogenic diet was developed as a successful treatment for epilepsy at the Mayo Clinic, it remains drastically underutilized. Let's explore for a moment just what underutilized means in this context. Today, there is a world epilepsy population of around 60 million people. Going back to the 1920s, all the published data from different doctors at different hospitals in different decades have shown remarkably similar outcomes. At least a 50% seizure reduction in over half the people with epilepsy who try a ketogenic diet, with 15 to 24% attaining seizure freedom. Project those numbers back to the 1920s when the diet was developed, and the amount of avoidable human tragedy is unfathomable. Today, the myths that for decades were used to talk physicians and their patients out of the diet for epilepsy have all but been dispelled. When administered properly, the diet is safe, it does not cause cardiovascular disease, it does not stunt growth. Its mechanisms are largely understood. The meals are delicious. The most prevalent adverse effects are easily prevented. The risk is minimal, and the probable reward is at least a 50% seizure reduction. Nor is the diet too difficult to maintain, especially when compared to a lifetime of seizures, drugs, invasive techniques, and, quote, progressive retardation, end quote. So why then are so many who would benefit from a ketogenic diet for epilepsy still without this treatment? Why in many places is the diet still considered a treatment of last resort? I've spent a good part of the last 25 years of my life working on that one. Here's what I've learned. There are pharmaceutical and medical device industries that make billions of dollars annually from anti-epileptic drugs and devices that have enormous influence on what doctors are taught and prescribed. Certainly no drug company is interested in sharing that after the failure of a first anti-epileptic drug, there's only a 13% chance a second will work and a 1% chance that a third drug will stop a person's seizures. There's a medical community that is virtually oblivious to nutrition and diet therapies. I ask any physician in this audience how much of his medical education was devoted to these subjects. A week? A lecture? There are sugar and processed food industries that make additional billions by adding sugar to pretty much all the processed foods that shape so much of global nutrition. Certainly they have no interest in promoting a diet that all but prohibits sugar. There's a cardiology community led by the American Heart Association that has demonized fat based on flawed science for the past 70 years. There's an insurance industry in the Western world that will not reimburse hospitals for trained ketogenic diet nutritionists, but are perfectly willing to reimburse for drugs, surgeries, hormone therapy, and devices. There are hospital systems that evaluate medical protocols based on revenue flow rather than efficacy. Hospitals profit handsomely from tests, invasive procedures, devices, and medications, but make no money from ketogenic diet therapies. In the U.S., even the professional epilepsy organizations have until very recently buried their heads in the sand. In 1988, AES announced its, quote, concerted effort to address issues on childhood-onset epilepsy, end quote. Astoundingly, 30 years after AES made this pronouncement, it is finally holding its first ever symposium on the ketogenic diet. To understand its bias, one must merely take a look at where AES obtains its funding. 25 years ago, my son Charlie was suffering multiple daily seizures, multiple adverse reactions from multiple anti-epileptic drugs, as well as multiple effects from a failed brain surgery. Even back in 1993, the evidence was overwhelming that the diet was not only the best treatment option for Charlie, but that there was less than a 1% chance another drug would work. Yet not one of the 6 pediatric neurologists he had seen said a word about the ketogenic diet. Then I did my own research and came across the mountain of published evidence about the ketogenic diet's efficacy. It included a Johns Hopkins study published in Epilepsy in 1992, just a year earlier, which documented seizure freedom in 29% of 58 consecutive children who were as sick as Charlie before they tried a ketogenic diet. We traveled to Johns Hopkins and initiated the therapy. Charlie's seizures stopped in a couple days. He was off all 4 of his medicines in a month. He was on the diet for 5 years. Today, Charlie is a happy 26-year-old school teacher who boxes, plays piano, and eats whatever he wants. He's never taken another anti-epileptic drug. He's never had another seizure. He has been cured. I realize that your very attendance at the symposium means that to an extent, I'm preaching to the choir. But I can't help wonder how many more stories like Charlie's success there would be today if only physicians had evaluated treatment options for epilepsy more objectively. I saw Charlie and my family suffer unnecessarily because his healthcare providers were influenced by factors other than Charlie's good health. It is the Charlie Foundation's most fervent wish that all of you can appreciate the lessons of history, and that this meeting will help you move more quickly to facilitate ketogenic therapies for patients as soon as medically appropriate. Thank you.